We're back for more Patient No Longer. And today I've got a wonderful guest, someone I've grown to really appreciate, admire, and get to work with. And that's Dr. Stephen Beeson. Doctor, it's good to have you here.
It's good to be here, Ryan.
Well, I'm excited. We have 4 physicians that we're featuring on this season. And you in particular, I'm so excited to talk about some of the issues that grip healthcare, but that you're very passionate about. You're the founder and CEO of Practicing Excellence. It's a nationally recognized group. You are a nationally recognized physician and author. Your mission is to help clinicians excel. You started your career with Sharp Reese Steely Medical Group in 1994 and later led the Sharp Experience Initiative to enhance patient care. Also founded Practicing Excellence to deliver skill-building programs for health systems focusing on well-being, patient experience, and leadership. Your initiatives include the Clinician Experience Project and the Nursing Experience Project, supporting a wide network of healthcare organizations. You have accomplished a lot, and yet when we talk, you are as fired up as ever. And I want to dig into one thing I've already mentioned that I don't hear a lot, and that's skill-building programs. Can you tell us about your programs and just the idea of building skills?
Well, it's a great question. And what I found as a family medicine physician charged at Sharp Healthcare with many other people to try to make the experience for patients better and the experience for care team members better. What I found is that to get those things to manifest, we had to do the behaviors that would allow that future to play out. And in order for those behaviors to play out, we had to not even really do a program. We had to have a layer and a cultural attribute of developing people to become their best so they can contribute to what we wanted to become and to do their work in a way that was drove contentment for them. So I have found that the ability to execute something, an organizational goal, requires us to develop the people doing the work to have the capacity to execute that goal. And when we don't do that, it is headwind and it is unpredictable and sometimes, frankly, impossible and a fool's errand if we're not giving the people the capacity and the skills and the mindset to do the thing we want to achieve.
We don't need to create any more headwinds in healthcare. We already have so many that we face. I love how you talk about the behaviors, and that was a very people-centered answer. And I think sometimes the trap is, well, if we're inspiring behaviors, we have our values, our organizational mission. Can anybody recite those? We have someone on this season who talked about in their organization, you can actually recite their mission. I think that's rare. Do organizations fall into that trap of saying, well, hey, there's a plaque on the wall. Why don't you just do these things?
Right. Well, it's really interesting. There are 3 different ways to try to change human behavior. One is sort of an outcomes-based human behavioral change mechanism, which is we need to improve our patient experience scores. You need to lose weight. And those are what we find is that using outcomes-based levers to create human behavioral change creates no behavior change. So when you tell patients to go lose weight, 98% of the time they take no action to do so. The second layer, which is slightly better but incomplete, is behavioral-based change, which is telling people to go do things, be empathic, be compassionate, listen to patients. And when we provision guidance on do these behaviors, the uptake in the application of those skills is slightly better than the outcomes-based rationale, but it's still incomplete and highly inconsistent. The most powerful driver of human behavioral change is identity-based, meaning who do you want to be in this life? And it's not your organizational values necessarily, but whenever I coach clinicians, I ask them, what kind of clinician do you want to become? And having asked thousands of clinicians that question, once they say, I want to be a trusted healer who makes a difference in the lives of patients to advance their journey to wellness, I said, we will use human development to allow you to be who you want to become. And that confluence between what clinicians want to be and what they actually are is a powerful driver, authentic driver of contentment, and been shown in every industry to be a predictable driver of human behavioral change.
When you ask them, what kind of clinician do you want to be? Is that the first time they've ever been asked that?
Yeah. Well, it's interesting. They hadn't thought about it for a while. And I got to tell you that, there's no clinician that finishes their training and says, 20 years from now, I want to be super cynical. exhausted and
These are
not
my
really,
goals.
yeah. I mean, they look at themselves and they go, what the hell?
Right,
What have I become?
right.
And buried underneath that is this dream of what they thought being a healer would be, which is a difference-making facilitator and Sherpa in the wellness journey of a patient. And the process of human development is just allowing that identity, that really why we are here, to play out by how they are showing up with patients and colleagues and even as team leaders.
You said something really interesting about change management and those different levels that people can approach. And the other thing I've noticed in change management is we don't talk about individual skills. There's these assumptions about who the doctor is or who the administrator is or who the security guard is. And we make these assumptions and we sort of put them into a bucket. How do you take them out of that? How do you turn skill building into part of change management so that the change can actually happen?
Well, first of all, the assumption that clinicians know how to interact with patients to render trust and I was heard and I was cared about and I feel confident in the care team, having shadowed over 1,000 clinicians over the past 20 years, even with the positive bias of a coach sitting in the room watching them,
Sure.
there's massive misses that occur daily throughout every clinical enterprise across the country. Everything from listening effectively and actively to patients, to identifying their fears, worries, and concerns, to what are the circumstances that they live in, to how they're understanding their care plan, to how to activate them to care for themselves. All of these things are specific behaviors and skills that clinicians should be able to do, but it's not part of the clinician training program. So clinicians' ability to interface with patients in a way so the patients walk out and say, this place, that team, that clinician is amazing. We know exactly what those behaviors are, and the delivery of those behaviors is highly variant, remarkably inconsistent. And what we have found is that the provision of guidance and mastery and skill building to do those things renders benefit to patients or to clinicians, because when clinicians begin to do those behaviors with patients, the patients respond in a way, you're the best. Oh
It
my God.
benefits patients too.
It benefits patients. And the clinician will notice that the patient is different when they show up differently, to listen effectively, to convey compassion, to ask patients, what about all that you're going through right now worries you the most? The patients will respond in a way that prompt the clinician to walk out of the room and say, that was amazing. And why we have found the correlation between patient connectivity and the experience of the clinician.
Yes. Okay. So I want to ask you about this because this is a thing that we talk about a lot at NRC Health, and we've had past guests on. One of the first episodes we ever had was about the physician-patient bond and how it kind of feels like it's been under assault. And I love how you talk about the benefits being both sides, both ways across that stethoscope. How do we continue to prioritize the patient? And I'll give you context for that. We always talk about our patients and we even say patient first. I got in a debate in a recent episode about, is it patients first or employees first? But ultimately, I think sometimes we forget about the patient. We get into all these initiatives, change management, whatever it is. We're trying to build physician engagement, and the patient almost becomes an afterthought. And yet they're the reason we're here. And I know you're passionate about this. How do we continue to avoid that and to prioritize the patient?
Well, it's the one thing that complex teams have in common. So kindness and compassion for every patient every time can be a powerful unifying theme that syncs with why people joined healthcare. And this thing about patients being first somehow implies that we're disregarding the team. It's actually just the opposite. By doing purposeful, deeply connecting, authentic connectivity work with the patients that we serve, there's now 57 studies documenting that we as care team members are the greatest beneficiaries of deep connectivity to patients. And a vigorous scientific evaluation of this came in Steve Treziak's book, The Wonder Drug.
Yes.
The author of Compassionomics.
Yes.
And he goes through a vigorous scientific evaluation of what happens to us as care team members when we deeply connect and make a difference for the patients that we take care of. So this idea that patients first somehow disregards the clinician care team member experience, not at all. The greatest dividend of a patient first strategy is clinicians and care team members become super proud of what they're a part of. They serve as a purpose that unifies why they joined this profession, and they get moment to moment oxytocin, dopamine, serotonin pulses of making a damn difference in the lives of patients, remembering why they are here. So patients first can actually be the most powerful countermeasure to burnout that we've got.
That is so impressive to think about it in that way and to tie it together. And it's not patient experience is just another thing. It is the thing, and it can benefit you. It benefits people who aren't the patients. And of course, it benefits them as well. I love that. And also, when you're talking about whether it's burnout or change management, we're kind of getting into culture territory. And you have a lot of great ideas and thoughts, and you've done a lot of work on culture. Tell me about how our listeners, our viewers, can create a culture where care team members not only stay, retention is important, it's been difficult in healthcare, but that they stay and they're engaged.
Right. Well, I think that there's really two critical steps in creating change. One is a bold, clear declaration of organizational intention. Because once we say, kindness and compassion for every patient every time, as an example, as I said before, as a declared intention, and then we declare another intention of honor and respect for every teammate in every moment. Those are examples of intentions.
Yes.
And those intentions are communicated again and again and again and again and again by every leader, every care team member, every executive, in every meeting, and every huddle. This is where we are going. This is our declared intention of the future state. And so that's step one. So everybody knows exactly where we are going and what we seek to become.
Right.
And the second thing is we have to develop the competencies to allow that to actually manifest. So intention and competencies. So competencies are, if we are declaring kindness and compassion for every patient every time, that wouldn't it make sense to have a continuous improvement strategy to develop the skills so patients are actually experiencing that, and we are doing evidence-derived behaviors in the exam room at every touch point that actually render kindness and compassion for every patient every time. And so the human development strategy really falls into three key categories to allow competencies to manifest that drive benefit for employees with higher engagement and reduced turnover and loyalty of patients. And that is highly effective leadership, meaning what are the leader skills that we do to engage our people? Right. We've identified 12 leader skills. Right. And the variance and the capabilities of leaders, manager and above, to do that is, again, highly variant. So leadership effectiveness, which is, again, where human development comes in, continuous improvement of our leadership capabilities to engage our people. The second is team collaboration. Healthcare is a team-based sport.
Exactly.
And becoming an amazing teammate and there for each other, support each other, low authority gradients, approachability, psychological safety, those two are skills and behaviors. So if we want to create a collaborative environment where people are there for one another and help each other and lift each other, we have to develop the skills and the mindsets and the behaviors to actually have that to manifest. And the third channel is patient connectivity. The skills that we do as we touch patients, so empathy and compassion and listening and establishing confidence and first impressions and managing clinical uncertainty, all the skills that make for amazing care team members as they touch patients. We have to do the behaviors of the patients who, again, walk out and say amazing. So building skills under the competency umbrella of highly effective leaders, deeply collaborative teams, and connected to patients. I don't know how you get those things to manifest without a continuous improving coaching culture where we develop our people to have the capacity to do those things.
We just love to launch initiatives without all of what you just talked about. And that is really the meat of change. And I've got to ask you this because I love the way that you talked about the two-step process. So we've got the bold, clear, declared intention, and then all that we have to do to be competent and develop those competencies and continue to develop. I'm curious, when you take intention and competencies, you've been all over the country working with physicians and leaders on this. Which one is missing more often? Do you find the competencies that we're working hard, but we don't have the declared intent? We don't have that overall vision, or do we go out with the intention and then we don't do the work?
Right. Equally ineffective across the country. Okay. How's that? Yeah. So the measure of success in a declared intention is that I could go to anybody in the organization at any point as they're walking to the car after a shift
Okay.
and say, tell me what we stands for and what it means to be us. And if they
That's the
can't,
test.
if they can't answer clearly and wrap their arms around and embrace with great pride and specificity, this is what it means to be us. Because that understanding of what it means to be us is the role of leaders, to be able to create an intention that is not only clear and specific, but also syncs with why we're in healthcare.
Right.
And it is the house that a human development strategy lives in. Because once we declare kindness and compassion for every patient every time, God, it would make sense that we would continuously build our skills to allow that to manifest.
Makes perfect sense.
Right. And without the intention, and you start building skills, you're going to go, I don't have time to do any of this. So the ability to embrace a skill building mastery journey that never ends to advance the skills of patient connectivity, team collaboration, and leadership effectiveness, the house that lives in is the organizational intention.
So
And they're both missing.
They're both missing, right? It's like a coin flip,
So-
and we're looking for heads and it's tails on both sides. And,
Right.
and I do want to clarify for those listening, Dr. Beeson he looks very warm and approachable. So if you did come up to someone as they're in the parking lot, I'm sure they would still talk to you. And the parking lot test, I think that's such a great way. And those things don't show up on employee engagement surveys or bar charts at the board meeting.
Right.
It's such a pure and simple test.
Right.
I love the idea of what you talk about with leadership. So I want to ask you a question based on some tension that I think exists, but I'm going to hear it from you, between sometimes physician leadership, which can be quite locked in about what physicians need to do within the organization,
Mhm.
and then executive leadership. They should be on the same page. But as you're finding across the country, do you see them on the same page? Do you see a tension between them? And how is it now versus, before COVID? What's the trend?
Right. Well, I think it's in order for leadership to lead in a way to engage people and drive change, there has to be unity between physician and administrative leadership. And they have to be moving in the same direction and both deploying proven leadership approaches that are proven to engage people. And it's really important. I tell physician leadership all the time, and any leader, our role is simple: to help our people soar, become their best, and contribute to our mission and our intention, and to do their work in a way that allows them to feel joy and contentment and fulfillment. And those experiences, 80% of that engagement equation is predicted by how it is that we're leading. So if the physician leadership sees their position as an opportunity to defend physician turf, to make sure our agenda is met, with distrust with the administrative partners, it's very hard to do that, because the role of all leadership is to help our people soar. And in order to do that, we have to have a universal way of leading, and we have to have that declared intention. Everybody has to be synced and supportive of that. And their role to the people that report to them is to convey the intent and to utilize growth mindset, self-awareness, vulnerability, low authority gradients, out-front leadership, listening and responding, all the leadership behaviors that we know in every industry to work. And again, I think great organizations, as we deploy a human development strategy, we have to develop our leaders so we're all leading in a way based upon highly effective leadership skills to engage our people.
The way you talk about some of these things, I find so inspiring, and I think our listeners pick up on it as well. Help our people soar. For physicians, have some pride in what you're doing. Develop skills, which we mentioned at the outset is missing. And I think sometimes we can aim higher, we can be greater, and we can talk about those things and not get lost in the businessy, that sort of thing. And I love the way you do that. So now is the ultimate test, Dr. Beeson. You're about to enter the speed round.
All righty.
This is where some people excel and some maybe not so much. Anyway, I'm going to ask you a couple quick questions. Don't overthink these. They're fast, and we want gut reaction from the doctor. Dogs or cats?
Dogs.
The beach or the mountains?
Beach.
Okay. That was hard. He was straining there.
That was a little bit of a dilemma, but yeah, I love
That's
both.
okay. That's okay. Morning person, or are you a night owl?
Morning.
Morning, okay. Favorite TV show of all time?
Gosh, Saint Elsewhere. How's that?
Oh, that is my favorite answer. There's people that really struggle with that one. Saint Elsewhere, oldie
That's
but a goodie.
oh my gosh, that was my inspiration.
Okay, and everyone this season we're asking this. I know your answer, but I'm going to ask you for continuity's sake. Always good in research. San Diego or LA?
Oh gosh, please, really? God,
There's been
San
some LA
Diego.
folks. Okay.
Really good. Yeah.
San Diego all the way. I knew that. And for those that don't know, Dr. Beeson does live in San Diego, but
Yes.
consistency is key. And speaking of that, the 4 physicians we've had on this season, you being one of those 4, I have asked this physician-based question. I'm very curious. It's a little bit existential, but you know, we've seen the chaos. We've talked about the burnout, when change doesn't happen, COVID, all the things that we've been up against as headwinds. What is the future of the physician in America? When we think about America's doctors, you're so vital and important to this country. What does that future look like?
It's a great question, and it's a challenging question. And I'm going to give you a little bit of context before I answer it.
Of course.
Is that there was a study that I read that current U.S. medical school graduates, only about 50% of them have the intention of seeing patients.
Wow.
Yeah. So they're using medical school, medical education as an opportunity to get into other areas, which is a great threat to our capacity to care for our populations.
Right.
That being said, I think the role of the physician going forward is leader of multidisciplinary teams managing populations of patients with technology enablement and utilization of lots of different disciplines to go upstream in care and prevent illness. Because 80% of our dollars are still spent in reactive care,
Right.
which is the least effective and costly way of administering care. So if I were to imagine sort of the next version of healthcare is about how do we go upstream and how do we access teams to manage with technology enablement large populations to help us diminish our chronic disease burden through an effective, accessible healthcare delivery system led by physicians.
And that's the future that physicians want. It's the future that patients want. I have to ask you this because we've talked about this a lot, and NRC Health's mission has been human understanding, something you know a lot about. People hear about human understanding. If they're listening to this content on our website, they see it. We've written a book called Patient No Longer about it. But I think sometimes people hear that, they get excited, and they still say, so how do I put this into action? And you're so great with taking ideas and getting them into what you actually have to do, those competencies. So when you think of human understanding, and for the listeners who know that well, how do they put human understanding into action?
Well, it's really interesting. One of the great areas of fascination I've had is the ability to gather intelligence, understanding in terms of the experience of patients, the insights of patients and care team members, and to be able to use that as a substrate for what we do next. And, you know, coupling the idea of gathering information, asking, querying, and having actionable data is what do we do with that? And I would even contend that full human understanding without response to what we learn is highly ineffective in creating change. So we must use human understanding, an authentic, deep, comprehensive understanding of what our people and our patients are experiencing, and using that picture and that landscape to distill actionable things that we can do in the exam room and with each other. And like a reflex arc, we you know, there's a chance to sort of gather information and respond to the information. And I think that cycle is an imperative. And I've always told healthcare leaders, as we begin to provision data to clinicians, it requires us to give them tools to respond to that information.
And I think that's so effective. And I know people so enjoying spending time with you talking about, yes, I believe in the movement. help me turn it into action, which is something you've turned into quite the specialty. So I ask this question to end every podcast. I could talk to you all day, but I want to know your answer to this. And I think the person in this scenario, for frequent listeners, you know where I'm about to go. I think this person will be really enjoying this elevator ride. Person on day one, first day in healthcare, starting out. We don't know where they are in healthcare. It's just day one in this industry. They get in an elevator followed by you. Short elevator ride, but they turn to you and they say, hey, Dr. Beeson, this is day one for me. What's one thing I should know as I start my healthcare journey?
You know, that the best moments of the human experience are sitting right in front of you with your teammates and your patients. And there are going to be super hard days that are frustrating. You got to remember your ability to be a light in the world for the people that you care for can lift you above and beyond almost any obstacle you run into.
A light in the world. I mean, that's
Yeah.
fantastic. And I think people can really take that. You also mentioned so many great ideas, and we're going to link those into the episode description so they can dig in more on what you do, Dr. Beeson, and what practicing excellence does. And I just want to thank you for joining us for Patient No Longer today.
Delighted to be here.